Welcome to OET Answers.
Your preparation time is over. You can now start your role play.
Don't worry if I stop you when the time is up.
Hello, good morning. I'm Nurse Narso Andrew and I'm here to help you. What brings you to the hospital today?
Good morning, Nurse Andrew. I'm here because I have been having these terrible skin rashes for the past few weeks. They are very itchy and red and they appear all over my body.
I'm sorry to hear that. Well, before proceeding, could you please tell me your name and age for the documentation?
Yes, nurse. My name is Patricia, and I am 35 years old.
Thank you for the details, Patricia. It would be great if you could briefly describe your condition in your own words.
Sure, I will. They occur almost every day, sometimes more than once. They usually last for a few hours and then disappear. But they leave marks on my skin.
Oh, I see. How do the rashes look and feel?
They look like raised bumps or welts, sometimes with blisters. They feel very hot and swollen and they make me scratch a lot.
I can understand how hard it might be for you. If you don't mind, for more insight into your condition, I would like to ask you for a few more details.
Why not?
You may please go ahead.
Thank you for your permission, Patricia. Do you have any other symptoms such as fever, headache, nausea, etc.?
No, I don't have any other symptoms.
Just the rashes.
All right. Do you have any idea what causes the rashes?
No, I don't. I haven't changed anything in my diet or lifestyle recently. I don't know what I'm allergic to.
Okay, Patricia, for confirmation, let me summarize what you have told me so far. You have been having these terrible skin rashes for the past few weeks. They are very itchy and red, and they appear all over your body. They occur almost every day, sometimes more than once. They usually last for a few hours and then disappear. But they leave marks on your skin. They look like raised bumps or welts, sometimes with blisters. They feel very hot and swollen, and they make you scratch a lot. You don't have any other symptoms, such as fever, headache, nausea, etc. You don't know what causes the rashes, and you haven't changed anything in your diet or lifestyle recently. Is that correct?
Yes, nurse, that's correct.
Thank you for confirming, Patricia. I appreciate your cooperation and patience. Based on your description, it sounds like you might have a condition called urticaria or hives. It is a type of allergic reaction that affects the skin. It can be triggered by many things such as food, medication, insect bites, stress, etc. Sometimes the cause is unknown. Do you have any questions for me so far?
Urticaria.
Is that something serious?
Well, don't panic, Patricia. Urticaria is a common skin reaction that occurs when your immune system overreacts to something that it considers harmful.
So you mean, I could be allergic to anything?
Well, not exactly. Some people are more prone to urticaria than others, and some triggers are more common than others. For example, some of the most common allergens are nuts, eggs, shellfish, strawberries, penicillin, aspirin, latex, etc. First of all, we have to find out the reason behind it.
How can I find out what I'm allergic to?
Your question is valid. Here are some tests that can help to identify your allergens, such as skin protests or blood tests. However, these tests are not always accurate or available. Sometimes the best way to find out is by keeping a diary of what you eat and do and when the rashes occur.
I see that as more practical.
Definitely I will do as you said. By the way, how can I get rid of the rashes?
Patricia, I will explain some of the ways to get rid of the rashes. Some treatments can help reduce the symptoms and frequency of urticaria. The most common ones are antihistamines, which block the action of histamine, the chemical that causes rashes. Antihistamines can be taken orally or applied topically. Apart from this, there exist corticosteroids, which reduce inflammation, swelling and immunotherapy to enhance immunity.
Okay. Do they work well?
Yes, they work well for most people, but some may have side effects such as drowsiness, dry mouth, etc. You should follow the instructions on the label, or consult your doctor before taking any treatment.
All right. Which one is best for me?
Patricia, your concern is natural. However, I am not the authorized person to provide such information. That depends on your condition and your medical history. You will need to see a dermatologist or an allergist for a proper diagnosis and treatment plan.
Okay, I got it. And what can I do to prevent or reduce the rashes in the future?
The best way to prevent or reduce urticaria is to avoid your known allergens as much as possible. You should also wear loose clothing that does not irritate your skin. Apply cool compresses or calamine lotion to soothe your skin, and avoid scratching or rubbing your skin.
All right.
Is there anything else I should know?
Yes, it would be great if you know when to seek medical attention. Patricia, you should see a doctor if your symptoms worsen or do not improve with home remedies. You should seek medical attention if you have difficulty breathing or swallowing. If you have swelling of your face, lips or tongue. If you have signs of the infection such as pus or fever, or if you have severe pain or bleeding.
Okay. Thank you very much for your help, Nurse Andrew.
You're very welcome. I hope you feel better soon. If you have any more questions or concerns, please feel free to contact us anytime.
Thank you very much, Nurse Andrew.
Have a nice day.
You too, Patricia. Take care.
Thank you for watching. Kindly comment your suggestions and help us do better.